High blood pressure or hypertension is a major risk factor for the development of heart attacks and strokes. When the heart squeezes, it forces blood out into the arteries of the body. When this occurs, the blood pressure in the arteries increases to a peak and then falls when the heart relaxes and fills with blood, awaiting the next pumping cycle. Hence, a person's blood pressure is constantly changing throughout the heart pumping cycle. This is a typical tracing. Systole is the period of time when the heart is squeezing blood out. Diastole is the period of time when the heart is relaxing and filling with blood. Whenever we record your blood pressure, we record the highest number during the heart pumping cycle and the lowest number. The highest blood pressure we call the systolic pressure, and the lowest number we call the diastolic blood pressure. The risk of developing heart attacks and strokes increases with increasing systolic and diastolic blood pressure. This figure shows the tremendous increase in the risk of developing a heart attack or stroke as the bottom number or diastolic blood pressure increases from 70 to 105. This figure shows the larger increase in the risk of heart attack and stroke when the top number increases from 105 to 195. In the past, the major focus in blood pressure control was on the bottom number or diastolic blood pressure. The reason is that all of the clinical studies which looked at the effect of blood pressure lowering medications on the risk of heart attack and strokes were based on the change in the bottom number or diastolic blood pressure. The first study with blood pressure medications was the original VA cooperative trial, where they took patients who had diastolic blood pressures between 115 and 130. There was a 13-fold reduction in the risk of having a heart attack or stroke when blood pressure medications were used. In the second VA cooperative trial, they showed that patients who had diastolic blood pressures between 105 and 115 were 4.5 times less likely to develop heart attacks and strokes when blood pressure-lowering medications were used to lower blood pressure. 5 other studies showed only small improvements in the risk of developing heart attacks and strokes of 20 to 25% when blood pressure medications were used in patients whose bottom number of blood pressure was between 90 and 105. However, 3 studies showed little or no improvement in the risk of heart attack or stroke when the bottom number was between 90 and 95. The presumed reason for the failure of blood pressure medications to reduce the risk of having a heart attack or stroke with lower levels of blood pressure was that the benefit of reduction was reversed by the side effects of the medications. The typical side effects were low potassium, low magnesium, an increase in cholesterol, an increase in triglycerides, and a reduction in HDL cholesterol. For this reason, the majority of physicians in our country have elected not to treat patients with high blood pressure until the bottom number is greater than 90 to 95. Hence, patients with blood pressures of 160 over 70 or 170 over 70 are typically not treated for high blood pressure, even though the top number is high. In the past several years, however, research has shown that treating the top number of blood pressure is beneficial even when the bottom number is less than 90. Let me show you why it's beneficial. The coronary arteries are located on the outer surface of the heart. If we measure the pressure inside the heart during the pumping cycle, you would see a pressure curve like this. When the heart squeezes the blood out, the pressure increases until the blood has been pumped out. The heart then relaxes and the pressure falls close to zero. As the heart fills with blood, the pressure gradually increases until it is full, and then the heart squeezes the blood out again. The main difference between the pressure curve in the heart and the pressure curve in the arteries of the body is in diastole, when the blood pressure inside the heart falls much lower than in the arteries of the body. When the heart squeezes blood out, the pressure inside the heart is greater than the pressure in the arteries of the body. This increased pressure inside the heart compared to the aorta is what causes the blood to flow from the heart to the arteries of the body. As previously stated, the coronary arteries run on the outside surface of the heart. Since the pressure inside the heart is higher than the pressure inside the coronary arteries when the heart is squeezing, blood will not flow to the heart muscle itself from the arteries during systole. The heart muscle only receives blood and oxygen during diastole when it relaxes and the pressure inside the heart falls below the pressure in the coronary arteries. This difference in pressure during diastole, or the relaxation phase of the heart, is what pushes blood from the coronary arteries into the heart muscle. The top number of blood pressure represents the work of the heart and the stress on the walls of the arteries. We now know that 95 to 99% of the time, the actual cause of a heart attack or stroke is the sudden formation of a blood clot in the wall of an artery feeding the heart or brain at the site of a cholesterol blockage, which totally blocks the flow of blood. This sudden formation of a blood clot is caused by an injury to the artery wall in which the skin of the artery wall becomes broken and exposes the cholesterol and fatty materials inside the cholesterol blockages to blood. The clot closes the artery off. The ideal circumstance would be to have a low top number of blood pressure to prevent the artery from being torn with blood clot formation and an adequate bottom number of blood pressure. This would minimize artery damage and ensure that the heart muscle receives adequate blood and oxygen. In the systolic hypertension in the elderly program, or the SHEP study, over 4,700 patients between 60 and 90 years of age who had top numbers of blood pressure greater than 160 and bottom numbers less than 90 were split into two groups. Half received blood pressure medications to lower the top number of blood pressure at least 20 points or to less than 140. The other patients were not given any medications. After 1 year, the average top number of blood pressure in the patients who were treated with medications dropped 15 points, while the diastolic or bottom number only dropped 2 points. In the next 4 years, all cardiovascular events were reduced by 44% in the patients who received blood pressure medications. Strokes were reduced 36%. Heart attacks were reduced 32%. The need for bypass surgery was reduced 36%. And the development of congestive heart failure was reduced by 53%. In addition, the need to go on dialysis for kidney failure was cut by 36%. Reducing the top number of blood pressure to less than 140 not only reduces the risk of stroke, but also reduces the risk of heart attack and congestive heart failure. This can easily be accomplished with medications that are proven to be well tolerated. The other study which confirmed this study was the TOM study, in which they took several hundred patients who had top numbers of blood pressure between 140 and 150 and bottom numbers of blood pressure under 90. Again, half of the patients were treated with medications to lower the top number to less than 140, and the other half were not treated. After just 3 years of therapy, there was a 35% reduction in heart attacks and strokes in those who received medications compared with those who did not receive medications. In the SHEP study, the benefits of therapy were as good for patients in their 60s as it was for patients in their 70s and 80s. In addition, women in the study received as much benefit from treatment as did men. It has recently been discovered that there is an inverse relationship between the systolic blood pressure and the loss of IQ with increasing age. That is, the higher the top number of blood pressure, the greater the loss of mental powers with increasing age. Autopsy studies on people who died and were thought to have Alzheimer's disease have frequently shown multiple teeny strokes. The likely explanation is that when a person has a high top number of blood pressure, the small vessels in the brain break, causing small amounts of blood to leak out into the brain, producing very small strokes. Since the amount of brain damage is very small when these small arteries break, no change is noted by the person immediately. But after 100 to 200 of these very teeny strokes, enough damage occurs to reduce a person's mental powers. It's important for you to understand the longer the top number of blood pressure is high, the longer the damage continues, and the higher the top number, the greater the damage. Many patients take their blood pressures at home, and it is well known that blood pressures that are taken at home are 10 to 15 points lower than blood pressures taken in the doctor's office. This is commonly called the white coat syndrome. For this reason, patients who monitor their blood pressures at home should be certain that their blood pressures at home are less than 130 on top rather than 140 if taken in the doctor's office. The proper way to measure the top number of blood pressure is to actually perform the blood pressure measurement 4 times while seated after 5 minutes of rest, and to average the 4 measurements together to come up with a single number. For these reasons, we are changing blood pressure protocol in patients who come to our office and whose top numbers appear to be greater than 140. If your blood pressure is less than 140, there is no reason to take 4 measurements and average them together. But if your top number is greater than 140, we will repeat the measurement 3 times and take an average. Blood pressure should be measured after resting quietly for 5 minutes in a sitting position. Patients who have diabetes, however, should have their blood pressure lowered to less than 130/80. The reason for this is a dramatic reduction in the loss of kidney function when blood pressures are lowered to this level. An important study was published in 1993 by Dr. Parving, in which he took a group of patients with diabetes who had high blood pressure. When he treated them with enough blood pressure medications to lower their average blood pressure to 140/97, their kidney function worsened by 25% over a 2-year period of time. He then treated their blood pressure more aggressively and reduced it to an average of 128/84. Over the next 2 years, there was only a 10% loss of kidney function. Hence, it's important to lower blood pressure in diabetics to less than 130/80 to prevent kidney failure. In summary, it is important to lower the bottom number to less than 90 and the top number to less than 140. Patients who have diabetes should lower their systolic blood pressure to less than 130. The realization that it's important to lower the top number of blood pressure, even when the bottom number is less than 90, is an important breakthrough in the prevention of heart attacks, strokes, and congestive heart failure. I hope this educational video has helped you understand the nature of blood pressure and its effect on your life. With proper control, you will not only improve the quality of your life, but very likely the length of your life.